I want to go over, again, a little bit more terminology with folks, just in case they see their own pathology lung biopsy report, or they see their own chest CAT scan report. And so when we do CAT scans and we do lung biopsies, the reports don't typically include the term idiopathic pulmonary fibrosis. That's what we call a clinical diagnosis. And so the term that is seen as it's up there is usual interstitial pneumonia. And so that's a pattern of abnormalities, both on a CAT scan and on a biopsy result, that the pulmonologist takes those results, the CAT scan, the pathology, and other blood work or whatever else needs to be done, and then ultimately designates someone as having the IPF or not. So again, the term usual interstitial pneumonia is one that people ought to be just a little bit familiar with, and again, it is a descriptive term related to pathology and CAT scan results. And then pulmonary function tests. A couple abnormalities that we typically see. That we follow in people with IPF, and one is a restrictive defect, and as the lungs scar, unfortunately they tend to shrink, and that allows people to bring in and inhale and exhale less air, unfortunately, and that abnormality is described as being restrictive in nature, or low lung volumes. And then the diffusing capacity abnormalities that happen in this disease. So that measurement, the diffusing capacity, is a measurement of the lungs' ability to absorb oxygen, and abnormalities on that front can also occur. And again, that sort of contributes to some of the low oxygen levels and shortness of breath that people experience. How we make a diagnosis ultimately is done with those CAT scan and pathology findings, if a lung biopsy is in fact performed, pulmonary function test findings, and other causes, or the medical term is etiologies, have been ruled out. And so what we're really talking about here is ruling out exposures that might obviously explain fibrosis, and then ruling out other underlying systemic diseases with which pulmonary fibrosis may be associated. And here we're mostly talking about the autoimmune conditions.